7:01.
I was yelling at him that he was late.
Oh.
Okay. Good evening. This is a meeting of the North Andover Board of Health, Thursday, May 26, 2022, a little after 7 p.m. I'm Joe McCarthy, Board Chairman, and on my left is Michelle Davis. She is the Board Clerk. On my right is Dr. Patrick Scanlon. He's a town physician. To Pat's right is Brian LaGrasse. He's Director of the Department of Health. You can't see her, but this is Tony Wolferdam, way in the far right. She's Administrative Assistant. And to the far left is the town nurse, Carolyn Lamb. So we do have a quorum. The meeting is open, and the first order of business is the Pledge of Allegiance. I pledge of allegiance to the flag of the United States of America and to the republic which stands one nation, under God, indivisible, with liberty and justice for all. Before we proceed, I just want to note that Dr. Max Tilson, a board member for the last several years, is no longer with us on the board because he moved. He moved to Newburyport. So board members have to live in the town. Town employees do not have to live in the town. He'll be missed a lot. A quick story. When he first became a member of our board, I spent some time around then with Dr. Frank McMillan. He had been my predecessor board chairman, and he stopped by my house as he did every now and then in the summertime, and more often than not I'm working in the yard. And we talked about a lot of things, and I said, Frank, Jesus, Frank, you know a lot of stuff. You're really smart. And Frank said, where do you meet Max? And he's right. Max is really, really smart. Even more important, he's a good man. He has been a valued asset to our board, and he's certainly going to be missed by all of us. Moving on, approval of meeting minutes. Michelle?
We have two sets of minutes to approve today. We have March 24th, 2022 and April 28th, 2022. Both have been reviewed, edited, and are ready for approval. So I make a motion to approve the minutes for both of those meetings.
I'll second.
I thought I'd make it easier.
All those in favor say aye.
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 Minutes approved. And by the way, Tony, good job in the minutes. They were really good, really good. Old business, COVID-19 update. Boy, this has been with us for years, and it appears that not that much is happening, and maybe no news is good news when it comes to the coronavirus, but then again, it's all yours.
Good point. Okay. Yeah, no news is good news. Things have been status quo for the past couple of weeks. We have seen a small dip down in our overall numbers. I did attach the information and all of the charts. They're in your packets, as well as the Greater Lawrence Sanitary District samples and the virus concentrations. Things have definitely died down since our holiday peak, which is great. Last week we had a total of 74 active cases on Thursday, and this week we have about 79 right now. So we're kind of mulling around that 70, 80 area. A few weeks ago we were at 90, 99. So we've been kind of hovering here for a while. There's been a lot of talk about the variants and things like that coming around. They have been more transmissive than the original strains, but they're not as lethal, and they are seeing less virulent symptoms. The number one thing we can do is to get vaccinated. The vaccines and the boosters still work. They still reduce your chances of having severe symptoms or worse. So we are trying to encourage that as much as possible. The 5 to 12-year-olds are allowed to have boosters now. That came around recently. We are still in the 50-plus age group for second boosters at this point. I'm not sure what's going to happen with the 0 to 4 vaccine approvals. I don't know where that stalled out. They were talking about having that approved in March or April. It's obviously now May.
I believe it's
Pfizer,
June.
now it's June. So slowly coming around, and as Dr. Tilson had mentioned before, that age group is one of the last unprotected reservoirs the virus can multiply in and stay around. We are obviously seeing evidence of waning immunity over time, which is why they're encouraging boosters. We are looking to do some booster clinics later on this summer before school starts up in the fall. We just met with the school department today, and we reached out to Greater Lawrence Family Health Center, and you can talk about that in a minute. But as you can see the charts, the active cases, 74 last week, 99 the week before, 91 the week before that. We're now around 79, so that's looking pretty good. The 14-day incident rate has been kind of up there at 56. If we had 100,000 people, that would be the number we would have per day. Our 7-day incident rate was up to 69, now it's down to 63. I have a feeling it's going to drop a little bit when I figure out the numbers for tomorrow. Hospitalizations up in the 800s last week. They're still around that point right now, so there's some hospitalizations out there. Half of them are incidental, where people don't actually know that they have COVID, but they're in the hospital for something else, and they test them, and they come back positive. We did have another death this past week. Somebody who was in their 90s passed away at a nursing home. Nursing homes are still getting hit, and you still have little clusters at some of the long-term care facilities that come and go on a regular basis. But yeah, moving along, still tracking the numbers, still encouraging people to get vaccinated. The school is still monitoring all of their students. I did put on the sheet, it's going to be published tomorrow. The U.S. Post Office is sending out 8 more free tests if you want them. You go onto their website, usps.com, order 8 more tests. They'll be sent to your house in the near future. I don't know if it'll be very near future, but it'll be in the near future. And that's all that I have for a COVID update this month. Anything else you want to add about vaccinations?
What is the predominant strain that was seen?
It's Omicron BA2 is the dominant strain. It's a subvariant of the Omicron variant. It's not enough to change the nomenclature and change the name, but it's a little bit different than the original Omicron strain. But very, very similar to the Omicron, just slightly different, a little more transmissive. Like I said, not enough to actually change the actual strain itself.
So it appears that these strains are more transmissive, but not as deadly. Is that correct?
Yes. That could be due to the vaccination rates. We have very high vaccination rates in the Northeast. Massachusetts is actually one of the leaders in the nation. And even our booster rates are really good. We've got 50% 50% of our population has been boosted. 50% of North Andover residents who are eligible have already gotten a booster.
And these numbers
So-
are quite high. Here in North Andover, for example, partially
Yeah.
vaccinated, 86%, fully vaccinated, 78%. And that's everyone, correct me if I'm mistaken. That's all the ways
Yes.
down to babies.
Yep.
And of course,
Exactly.
you know, the young children under 4 years old, they can't be vaccinated yet.
Correct.
So that number's quite high.
Yep.
What are you seeing out there, Patrick, as far as the virus?
Nothing. It's been months since I've taken care of a COVID patient in the ICU.
Been months, really.
Yeah.
That's very good to hear.
The numbers in the hospital are a little bit up, but only by single digits.
Okay.
Between all the local hospitals around here.
Brian, do we have any restrictions in our town?
Nope.
At all?
Nope.
I know that if you go to, say, a physical therapist's office or an occupational therapist or hospital, you have to wear a mask.
Yes.
Yet, as Patrick just said, he's not seeing much, if anything.
Mhm.
So I'm just wondering how much longer that will go on for. Do you have any idea?
I do not.
I would assume that in a healthcare setting, you're gonna be, I don't think there's an end in sight for that.
Really?
Well, because you're sharing waiting rooms with sicker patients that are immunocompromised, that have underlying medical problems, that you have the risk of transmitting it to other people. So I do not foresee that happening. Mask requirement being lifted in a healthcare setting.
Because of the virus, I know a lot of people have postponed certain tests. And like, for example, those that colonoscopy test. And there seems to be an uptick in certain numbers. Are you seeing that at all?
Uptick in certain numbers, meaning like,
In other words, people have not had the physical examinations during the pandemic as they would have otherwise.
I think that they're starting to come, I think those kind of numbers are starting to plateau because we're just now this far into the pandemic, where that initial phase that we were dealing where everything was shut down. Now, for the most part, most healthcare facilities, other than the wave we had in the wintertime, everything is really back up to full capacity now in all hospitals, so that people can get their colonoscopies, people can get their CAT scans, their mammograms, their routine physical exams, all appropriate cancer screening for age. There should really be no limitations from that standpoint. I think a workforce issue is certainly a problem of making sure that there's enough availability of people to be able to offer these services. That's a whole other conversation. But hospitals are open to be able to get these types of testing done.
Any problems at all getting the vaccines right now?
Nope.
What are you seeing, by the way, as far as vaccinating our people, and particularly the seniors? You're
So-
still actively involved?
I still get a few calls, but I was talking to the superintendent, and he was mentioning that any local CVS, they have 15-minute blocks, and you could pick any 15 minutes. There is no
Really?
waiting. You could pick tomorrow, and you could get right in. There's open availability to get boosters, first doses, second doses. So if you want it, it's out there, and you're able to get it.
Yep. It's readily available everywhere, which is good.
Very good.
To the backlog that kind of built up over the shutdown period, you guys have been clearing that backlog and getting back to the regular routine.
Yeah, I think that the issue we're finding in a lot of the hospitals now is more so the staffing to be able to keep these tests up and running. So I think that's more of the bigger issue right now. But for all the patients that are coming in to see me, they're getting their testing done within a routine time frame.
So are we still considered to be in the midst of a pandemic?
Yes, I think we haven't fully switched over to being endemic yet.
And-
These variants are not anything of a surprise at all. This is exactly what a virus does.
And will the CDC say that this is no longer pandemic, but this is endemic? Or who will tell us that?
Probably the WHO, World Health Organization,
WHO.
and CDC will have their input too. Because I mean, you got to think past the U.S. and what the rest of the world is dealing with too.
It's been a long haul.
Yes, it has.
Anything else?
Not on the COVID-19 update.
No, schools stopped contact tracing. Close contacts aren't subject to quarantine according to DESE anymore because the children aren't being hospitalized and it's not hitting them as hard. Hopefully we're trying to, hit some summer festivals and get children who are going to turn 5 in the 5 to 11, boosters before next school year starts.
Mm-hmm.
That's plan right now.
Do you see a combination, say, flu shot and COVID-19 shot in the near future?
Probably not in the near future, but capitalism at its best, I'm sure that they'll figure out how to combine them all together.
Throw in some lime and you're good.
Yeah, exactly.
Good enough. Moving on, new business, election of board positions.
I'd like to make a motion to nominate Joe and Michelle to stay at their similar positions for another year. Given the turmoil of the board and the rapid turnover, I think a sustainability of leadership would be at its wisest for another year.
Smooth
fine with
operator.
Huh?
I second.
Second.
There we go.
Okay, so all those in favor say aye?
Aye.
Okay. All those against say
No, not at all. Nope.
You say, given the turmoil on the board,
I
actually.
was just being.
Oh, there's,
I was
okay, because I don't
I
sense
was
turmoil,
joking.
but we lost two key people.
No, not turn. I was just.
Over the last several months, and we do have openings, so any of you that have an interest, get that information to you, Brian, and our town manager, Melissa.
You fill out a
Rodriguez.
form on the website. It's a talent bank application. Fill that out on the website, and it goes to the right people, and it gets then sent to me and documented. So hopefully, we do have some applications already. I'm hoping to maybe start some interviews next week, depending on everybody's availability. If they want to sit in, I would definitely like to have our board member present. So let me know who wants to sit in and when you're available, and we can start that process, either schedule for next week or reach out next week and then schedule for the following week. But I think obviously with Max and Daphne being gone, down a 3-member board, I'd like to move quicker rather than slower on this.
And hopefully we can have at least one, if not both of these openings filled by
Yes.
by our next meeting. By the way, I did see the I guess for lack of a better word, resumes here, and they look pretty good.
Yeah,
As far as the
Great
people that
applicants.
have an interest, so we will see what happens.
Two positions to fill this.
Last year this time, I thought that'd be my last year as, because this would be my third year as chairman of our board. And I've been on the board for many, many years, and I'm 75% of the way to 100 years old right now. So I hope that we have a new board chairman next year. But seriously, I can understand for continuity why you'd like me to continue. I've done it for a long time. And I have something that neither one of you do, which is free time. You're young, you have families, you have jobs, you have responsibilities. I don't have much going on in my life, but I do like being a member of the board, so I thank both of you very much. Okay?
That was a very humbling acceptance speech.
Yes.
Okay, so that covers the election of board positions and the update of board vacancies, communications, announcements, and discussions. You're going to get Ron Beauregard.
He'll be up shortly.
Oh.
He's doing a enforcement hearing downstairs via Zoom.
Oh,
He'll be up right after that. In the meantime, definitely take a look at the volunteer forms that I gave you guys. Let's maybe decide a few of you guys want me to schedule interviews with. And I can reach out to them as early as tomorrow or Tuesday and schedule them for maybe even the following week. So,
well, again, I don't have much going on in my life, so I'm available to help.
obviously.
But hopefully, both Michelle and Patrick will be able to
Is the first one actually
lead the
for
charge
us,
here too.
or is-
Oh, you're right.
Yes.
It is, okay.
Yep.
So evaluate all.
Yeah.
Okay.
Yeah, but that's definitely somebody we can talk to.
Okay.
They submit their talent bank application, and it's
Okay.
forwarded to me,
Okay.
and they do have a medical background, which is great. So rate them,
Yeah.
email me tomorrow, let me know your schedules for next week, and I'll see if I can get somebody to come and meet us.
Sure
We
you
can do
do.
it after work, or early evening, if you guys
Next
want.
week's tough for me. I'm in the ICU all week, so I'm out at 7 p.m. 7 a.m.
Okay.
to 7 p.m.
That's rough.
So
So it'll be the following week then. You get a reprieve the week
get a little
after?
bit- Yes.
Okay.
Back in the office.
Okay, all right, good.
Since Ron will be here in about 5 minutes or so, you want to talk about the animal regulations?
Yes, I gave you guys, this is a much cleaner, more complete draft than the last one. I went through and more of a fine tooth comb. I added in a bunch more definitions. I added in some more, made it a little bit more robust than the first draft that I gave you guys. So, one thing that I did want to go over, obviously we have to have a public hearing and vote on these. We can do that at the next meeting if you want to. That's in red on the section 2 and the purpose. If you want, I can set it for the next agenda. We can have a public hearing and we can vote on it.
Just have one comment, which we had discussed several days ago.
I haven't gotten there yet.
Don't steal the
Oh.
thunder.
It's on section 2.
Go ahead.
I'm just giving you.
New chairman always
Yep.
stealing the thunder.
I know, right? So,
It's gone to my head.
Yes. So one thing that I did is added in the zoning information. If you look on section 4, general requirements, I made these a lot more robust, and I mimicked some of the other town regulations. Table 1 is actually an extract directly from the zoning bylaw that talks about their requirements for, they only really address chickens in here, but I did want to include that in here, so it's part of our regulation as well, so we're not contradicting each other, and everything is more consistent. I did add in, I broke it down into different sections. For section 5 is permit requirements. Section 6 is application requirements, gets a little bit more in-depth as to what is needed to submit a complete application. And then further in section 6, this is what me, Joe and I talked about earlier, was I wasn't sure if you guys wanted new applications to have a public hearing with abutter notifications and give people in abutters the chance to see and talk about what they're proposing. Obviously, if somebody's gonna propose opening a piggery, that would be something you would want to make well known, because those are not clean operations. But they're clean. They just have some odors that go with them that tend to travel. So I don't know if you would need to do that for every single permit application that comes in. Most of them are people getting some chickens or some horses or some goats, like nothing over the top, like a huge giant farming operation.
Can we put some kind of criteria there, or can we, because we can't just say may, right? Like you'd need to be,
Right.
you'd need to be specific on who would or who
I
won't.
could add something in
It'd be
here.
at the discretion of the director. Obviously, we have a regulation.
Yep.
Much of it is generic. I don't think it's necessary for someone that wants to have a couple chickens to appear in front of our board,
Yep.
especially if there was not an issue of concern with the neighbors. So we may want to consider saying at the discretion of the director.
Yeah, if it's gonna be a major operation,
Yes.
public hearing may be required.
Yeah, I think it's worth having it in there as
Yes.
a may
Mhm.
be required.
Yeah, that's why I put that in yellow to
Yeah.
say, all right, this is a
Yeah.
question I had. I'll change that and revise that. I think the only thing we have to do for a public hearing is if there was an enforcement action and somebody was appealing an order to correct or a fine or something, then they would have a public hearing and they would notify their abutters that they were having an enforcement action. That's later on in the regulations, but, so that's section 6. 7 is just some construction stuff, in terms of where things need to be, in terms of setbacks, things like that, to mimic the zoning and conservation regulations. Section 8, standards of care. This will require a waste management plan for manure, shavings. When you take the manure out of stalls, you gotta put it somewhere. Just kind of goes through and talks about some requirements for that. And then enforcement and penalties, and then a right to a hearing. And then other variance requests. So if somebody wants to have a variance for these regs, then we do the public hearing. They would notify their neighbors. And that is it. So these I've been working long and hard. Finally, we started these last year. I'm trying to get them to a point where I think they're ready to go before you guys for an official vote and adoption.
And they look good.
Thank you. If you have any questions, let me know. I'll make the revisions for the next meeting. And then I'll work with, I'm going to give a copy to Conservation so they can take a look at it. The zoning enforcement officer, which is Paul Hutchins, and then the animal control officer as well. And then get their input and feedback. I know Brad, the animal control officer, has been involved from the beginning. I'll give him this latest copy, see if he has any other questions or concerns.
Who's the animal control officer now?
His name is Brad. I forget his last name off the top of my head.
him.
Yep. He's been here since for a couple of years now. Okay.
So you're gonna make that one change,
Yes.
and is that it?
Then we need the public hearing.
And
What?
then we'll do the public
Then we'll
hearing
need the
next
hearing.
month.
Yep.
Yeah.
Do you guys want me to do the signature page like we did for the tobacco regs? Do you guys sign the official copy?
Sure. Yeah.
Okay.
Yeah.
I didn't have it in here, but we can do that.
Yeah.
It's not necessary, but it
Yeah.
was very efficient.
Think we can have public hearing next meeting? or-
Yeah.
Good.
Yep.
Good work.
Also, on switching topics now, the Community Health Improvement Assessment. I gave you guys copies of this. This is the selection. We did the RFP. We solicited proposals. We got the application and the proposal from Health Resources in Action. I went to and met with Andover last week. We called up and did an interview over the phone with Abby Atkins, who works for HRIA, to go over their proposal. This is being changed a little bit from this copy, not much, just to we changed around a couple little things in here for their proposal to meet more of what we were looking for. So we did select this company. We do have the funding. We're going to be going forward with this process. Hopefully we will have them on board in June and they can start the process in July. This is a
What is the
double-
funding that we will get? And can you further elaborate for those who may be listening in and do not know much, if anything at all, about the community health assessment?
We got federal funding for health initiatives. This is a major initiative. So we have funding through the state and through the federal government. The American Rescue Plan Act funds are being used to fund this. We've gotten one specific grant from the state for this project specifically, and then some other funding we're using to augment it to do a little bit more with this proposal and get more of what we want. So, yeah, this is completely funded by the state and federal government. I've been looking to do this for 5 years.
And what do we hope to get out of this?
We're going to get some detailed data on the health disparities and equities in town, as well as the criteria that I think we need to concentrate mostly on, and then an action plan to actually tackle those issues. So assessing the health of North Andover specifically versus a region will focus it more as to what we need as a town and give us better direction as a health department of things that we can tackle, and we can really, we call it moving the needle. So if there's a measuring gauge and you see that needle move on something, we're doing good. And that's what we're going to try to target, and that's what we're going to try to do. So we did join with Andover just to keep some of the costs down. So we're going to do Andover and North Andover together, but we're going to have our own separate reports for each town. But mining the data and doing the staff work on the back end of it is cheaper to partner up with somebody that is very similar in size and demographics. So it will save us some money in the long run, but we have our own individual project at the end of it.
Okay. And that's been approved. And how about the other grant that has yet to be approved? That is a shared service public health.
Yes,
Grant?
so I don't have any paperwork for you on this yet. I've only done the application so far. It is a shared public health services grant, and it's for $300,000 for 3 years. So it's $300,000 every year for 3 years.
And how much
to
of that
hire-
will go to North Andover?
We're going to be hiring regional staff to help with a lot of the backlog work that we have and additional work that we can't get to with a conglomerate of towns. So we're housing the grant, so we're getting paid $45,000 a year to administer it as a town.
And when do you think that that will be approved?
Hopefully within the next couple of weeks. So I applied for it on behalf of Andover, North Andover, Reading, North Reading, Linfield, and the city of Haverhill. So we're looking to hire a training and grant coordinator. We're looking to hire a public health nurse for the region, and we're also looking to hire a regional inspector. So we're gonna set up some long-term training programs for all the health departments. We're looking to do some FDA standardization with food inspections. Looking to augment some public health nursing work that the region is lacking. We have Carolyn who's doing a stellar job, but other towns don't have a full-time public health nurse and have a real need for it. So we're trying to help some of the smaller towns out that don't have a full-time nurse get up to speed on everything they need to be doing and getting that work done.
Is this part of the state's push for regionalization?
Yep,
It is.
absolutely. So if we can come up with some regional programs, one of the things that we talked about was, for instance, a mobile food vendor. An ice cream truck or a taco truck or whatever kind of mobile food you have to get individual permits from every single town you go to and get inspected in every single town. So if we can have one regional person do all of those, it takes staff time, gives staff time back to us, and it's also easier for the vendor to only get inspected once versus 6 times.
Now, Massachusetts, I think there are like 353 cities, towns, villages, and so on and so forth.
351.
And many of them are very, very independent and want to maintain their autonomy.
Yep.
Do you see, if this goes through with the state's push, obviously, taking anything away from our department,
No.
our board, or only adding to what we do?
Adding to it.
Okay.
Adding to it. I think that's the big push, is to be able to add to it, but also be able to share some of the additional resources with towns that don't have everything that we have. So Linfield, for example, only has a public health nurse 1 day a week. So they have a need for more nursing. This will help offset their need and give them a little bit more. It doesn't take away from us because we have our own nurse here, but if we have a shared nurse for all 5 or 6 communities, then that will help them boost their public health nursing program. Vaccinations, contact tracing, communicable diseases, public health education outreach, stuff like that they don't get to because they only have a nurse 1 day a week.
Thank you. Comments at all?
On this more, it looks like a lot of this is virtual and surveys electronically. What is being done to ensure that those who are not virtual or electronic also have a voice in this process?
We are actually, that's one of the things that we changed here. We're going to
Okay.
do some in-person stuff as well.
Okay, awesome.
In-person stuff is more expensive, obviously, but when we met and interviewed them, we talked about that, and the new proposal has in-person
Okay.
as well as virtual, so we can do a combination of both. But I think you lose something when you do it virtually versus in person.
Right.
So
You
we
kinda
really
see
want to have it done
Yeah.
face to face.
Yeah.
So,
Yeah.
good catch.
Okay, thank you.
Anything else? Okay.
Anything else on that?
No? No? Good work, as always.
Thank you. And last but not least, we now have our tobacco regulations. I put copies in here. We did these in 2019. These were probably the toughest in the state at the time. I think if I'm remembering correctly. I also added Tony did this for me, thank you very much, great idea. This is a list of our retailers, and we've got, if you remember, we did a cap back in the day, and we gave a little buffer in there so a few more people could open up tobacco businesses in town here, and we made the cap at 16, with one adult-only 21 and over tobacco retailer. We've got 2 permits available and 2 are pending right now. So we're gonna be at our cap, which I never thought we would hit for a while, but it's gonna happen. So I asked Ron to come here and give us a brief update on our tobacco control program and answer any questions with the board. So glad to have you back, Ron. Good to see you.
Yes, good evening, Ron. It's been quite some time, primarily because of this pandemic, so
Yes.
delighted to have you back, talk a little bit about the Healthy Community Tobacco Control Program and specifically what you do. And it's all yours.
Well, thank you. Well, since I last saw you, of course, the state has now enacted the strongest state law in the country, and it overlooks and overtakes all of the local Board of Health regulations that pertain to any of the policies that are within it, which is 105 CMR 665. Some of the things that Brian was mentioning in regards to caps, it could be regulating price of your cigars. Those things are local regs, but the major issues in the state regulations involve sales to those that are under age 21. It made it official to be uniform throughout the state that everyone's 21, that everyone has to be 21 in order to buy tobacco. It prohibited all flavored tobacco. So unlike the local regulations that would allow an outlet for it, such as a vape or a smoke shop, the state laws remove that. A smoke shop or a vape shop is unable to sell any kind of flavored tobacco. In addition, it prohibited more than 35 milligrams of nicotine in any vape product that would be carried by a non-adult only store. So only the adult only vape shops and smoke shops can carry anything higher in a vape that's more than 35 milligrams per milliliter. I believe in North Andover you have a prohibition against all vapes at the convenience store level. I might be wrong on that, but I believe I should have known that as I came in here. When you're juggling 17 communities, I'm almost certain North Andover had that prohibition of vapes in the convenience store setting.
Yeah, it was only the adult-only tobacco retailers could have vaping products, but we wanted to get it out of the quote-unquote convenience store where kids go and buy candy.
That's right.
And gum, and there are vape pens sitting there.
Yes. So you were quite proactive in that area. There weren't many communities in the state that subscribed to that strict regulation. The eye opener, of course, on this law was the menthol cigarettes. You had closed that. I guess you call it loophole, if you will. I call it a loophole. The reason why most of the boards of health, including your own originally, gave an exception for menthol, mint, and wintergreen was because the law that started it all, that was challenged by the tobacco companies twice on the U.S. District Court Appeal level and the appellate court level in the First Circuit, was a Providence, Rhode Island law similar to the flavor prohibition that exists today, but it exempted mint, wintergreen, and menthol. We were concerned for purposes of litigation, you being sued, not to put that provision in, even though we always knew they were flavors. And in fact, menthol, I guess if you had a choice of what would perhaps make something go down easier, cherry, apple, or menthol, I think menthol would probably top the list since they put it in cough drops and such. So the eyebrows raised across the country. Again, no state law has had this. I believe California has a law passed, but they have an interesting setup there where a referendum can be set up to challenge a law. And there is, I believe, a referendum that's going to be held this fall. Tobacco companies had no problem raising the money to get enough signatures to challenge the law. So there'll be a ballot question, so it's kind of in abeyance. It's very similar to Massachusetts' state law, but we are still number one in terms of strictness, probably among the world as well. The other thing that raised eyebrows a bit was the fine levels for sale to an underage purchaser. And for that matter, the fines for any infraction of 105 CMR 665, which would be carrying a flavored tobacco product, and we'll say, just to keep to the main two policies, and selling to someone under the age of 21. It's $1,000 for a first offense, as opposed to, I believe in North Andover, it was 150 or 200?
300.
Oh, you went straight 300.
We went
You joined
high.
Methuen, yes.
Yeah, we went really high at the time.
It was high at the time, and it was the highest that state law would allow to have on a penalty that would be enforced through the non-criminal disposition statute, Chapter 40, Section 21D. So it kept it at the level where someone could go to a clerk magistrate to appeal it. But this is $1,000, and it's done now by a vehicle called a correction order and a cease and desist order. I've sadly had to issue 14 or 15 of these $1,000 fines. It's a big change for me. It's a big change to go in and issue a fine for $1,000, especially when you put your heart and soul into education, which we've always been first. And with Andover, we conducted checks, compliance checks, and we had one sale. It represents a 7% sales rate. I only calculated on such a small sales sample because we've now, of the 17 communities we have about 332 stores that we check. And I've checked 85% of them, or 282, as of yesterday. We actually conducted a few today, so it's a little higher than that. And again, we had a sales rate of 5% with 14 sales. So that's, I don't know how to feel about that. I initially feel pretty good. I think comparatively speaking, although we haven't shared all of that information across the state during our meetings that we have on regional meetings, I've been told this is a low figure, 5%. 95% sounds great. 95% did follow the law. But I still feel, and I don't know whether there's a causation. I never like to promote causation over correlation, but we put in the most education that we've ever had since I've been with this program in 2001. So over 20 years, I've never put in so much. I know even of those 332 stores, we've done, I just checked our database, over 600 inspections. So we've repeated, we've had specialized inspections. One provision, and I don't want to be long if you take any questions, but one of the catalyst for determining whether or not you're selling flavored tobacco or not, because it can get hidden instead of things being called cherry and grape and wintergreen. They can be green and gold and tropical paradise or whatever it might be, but it's sort of hidden. It's called a concept flavor. It's not explicit. And so what the law provides is that each retailer has to have in their possession, when we do an inspection, a list of documentation from the manufacturers of every product behind their counter. And there should be, anything on that counter should be on these lists that certify it's unflavored. We had a very poor compliance rate with that. We did put out statements for retailers to sign, but there still was a poor compliance. So I was fortunate that we had extra funding for this, the state. We really appreciate the state putting out such a strict law that they gave us some funding to help educate. And so I was able to have some great folks help us, go out there and help me. And just what we did is we helped them by letting them know the way to get those documents. An example of a meeting would be, instead of just saying you're going to be fined $1,000, no, we wanted it just to get it done. So what we did is we went to the stores, and where they didn't have them, which was the majority, I've gotten to know very well the distributors of tobacco in this area. There's about a half dozen or so of them. Call them up then. I get the owner on the phone or the manager on the phone while I'm at the store. I usually have 2 phones going. Talk to the distributor. Get the email address of the owner. I say, can you please send those documents right now? And they'll send them, and then the only thing they've got to do is print them out. And we're getting compliance. I think I haven't checked recently, but the last time I checked, we were over 60%. So that's a lot of stores and a lot of compliance. So I'll take any questions. And again, I feel good that I guess it's only 5%, but I look at, I don't know, somehow 5% sounds not so high, but 1 out of 20 sounds high. If I told you every 20th place I get a sale, that doesn't sound so good to me. So it all depends on the way you word things. I guess it depends on what side of the issue you are when you interpret statistics. So I'll
I think you
take any
reduce that
questions.
by doing more checks.
Well, that is an argument to be made. I will say this. When I told you that it's hard to issue them, you might notice that at a lot of stores, it doesn't have to be at a store that has a tobacco sales permit. It can be selling anything. There's this sign, and it usually has 2 words on it: help wanted. And it's uncanny. I can't, I feel for those who take the oath, so to speak, and promise and sign, but it doesn't come through. Now, we know that based on the law, there's really no excuse. You can't put someone at the wheel, so to speak, on such a... I think what happens is we want to guard against this. We always have, and I know you have, guard against it being sort of regarded as an innocuous thing, a mistake, which it is. By nature, it is a mistake. No one's rubbing their hands saying, oh, I can't wait to sell to someone that's underage. I hope to get them hooked on nicotine. So because of that, it makes my job interesting, because I know the act itself is one of neglect, of one of just not necessarily anything beyond that for a intent. The problem is the product that's going out to the consumer, and the underage consumer, happens to be the number 1 cause of death for a product in the country. It's still killing off about 450,000 people a year. It's number 1. I remember seeing a movie one time. It was called Thank You for Smoking, and it was about the seeing a tobacco lobbyist through the eyes of his 10-year-old son. And I'll never forget the tobacco lobbyist, the liquor lobbyist, and the gun lobbyist all got together for lunch every so often, and they talked about their day and how they had to deal with public opinion and pushback. And, one would be, just as generalizing, but the gun lobby goes, oh, they're telling me that X people are, killed by guns, and we're familiar with this right now, sadly, and liquor. But the tobacco lobbies would say, that's nothing. I got it all over you. I'm at 455,000, that are dying from tobacco. But it just happens sort of quietly. So we're trying, and I'm hoping that I'm putting in for a little extra funding for this coming fiscal year. I want to take off where we left off. And we're even telling folks that are in small mom and pop shops where they've sold, that if they can't find, sometimes it's a relative, sometimes it's a friend, don't put them in the hands of someone that you don't know is trained. And also, we're encouraging them to perhaps do things, carrot, a free lunch, do a secret shopper program. Large companies like CVS and Circle K and the et cetera, Cumberland Farms, they have secret shopper programs. I see all their cards, green card, green card, green card. That means you passed. They give them a little something. We're encouraging even the small stores to give a little something and have their friends and relatives maybe try to buy tobacco to test. So.
Well, several years ago, before we updated these tobacco regulations, I was the board member that was most opposed to doing anything at all until you came here with bags full of tobacco products that are targeted for children. And when I saw that, I changed my mind right away. And I've supported what we've done since that time. To an extent, the state has piggybacked upon what we've done here in our town. Keep up the good work. Getting back to our regulation, is there anything that we could change right now? Are you comfortable the way it is? Because you were not comfortable at all several years ago.
Well, now it's kind of an undo thing here. What I used to try to do, and I know Brian has helped us, and I believe the solicitor might have helped us in a couple of provisions here as well, here, your town council or solicitor. The answer to that is my recommendation and the recommendation of the Mass Municipal Association and Mass Association of Health Boards is to take your unique policies, such as the no vape sales at all in North Andover. That isn't in the state law. It's stronger than state law. To find those provisions, which I would do for you, and then insert them into a set of model regulations that mesh with the state law, so that somebody reading your local regulations won't get confused. They shouldn't be. They should know that the state law, anything stronger in the state law overcomes anything in the local law. But you can have a set of regulations that is seamless. It'll merge the two together, and I would recommend that. It goes against what I always wanted to do in the past, because I'd always amend and redline and insert things, because you spent so much time putting a body of work together that I didn't want to just sub it out and, this is what the Mass Municipal says you should do. Well, that's nice. They have good intent, but maybe there's some mistake. Maybe it's something that you don't agree with. But in this case here, I would let Brian know, this is all good. This is going along with state law, and then here are your provisions. There's nothing I would highlight the areas in your local regulations that are separate and distinct from. And that includes the penalty, by the way. If there's something, like for instance, your vape prohibition outside of the smoke shop, it wouldn't create a $1,000 fine. It would be a $300 fine, because it's a local provision.
Now, look at this regulation as dynamic. It's not static, obviously. Changes will continue to be made. Does anyone here have a problem with what he is saying? Or would it be wise, say, with input from you to work with and through Brian and us on any future changes? Comment? Okay.
Does the state have a suspension clause in there too when they have a sale?
Yes,
Okay.
they do. Now,
That's after one sale, correct?
that's correct. So,
That's
yeah.
a lot.
Okay, so I'll give you, Brian's kind of a sore subject with me a bit, but, and I neglected it. It wasn't purposeful.
No, I know.
But so the section that discusses violations is in the section that's, I don't know, called violations. Yeah, all right, so that makes sense. That's good. But what happened is when we started the education to the retailers, that was it. It was straight up $1,000 the first offense, $2,000 up to 30 days. I'm sorry, up to 7 days for the second offense, and $5,000 and up to 30 days for a third violation. We went on months and months and months. That was the way the template correction order was set up, until one of my colleagues and several of my colleagues, those months later, said, "Hey, there's this provision in the section before it, and now that section is more blithely, let's see, it's called Requirements for Retail Establishments. And it talks about how you have to have a non-mobile location. You can't have it in a cart. It mentions something here about you have to agree with doing inspections, unannounced inspections, or else you can't have a license. That makes sense. The third one of these four was, if you fail to pay the fines within the time period to appeal, you can't continue your license as well. This last one, the last one says, sale of a tobacco product by a retail establishment to a person younger than 21 years old shall result in the retail establishment being prohibited from selling tobacco products for up to 30 consecutive business days. So people started scratching their head on that one. Boy, it sure sounds like it's mandatory. And, when you kept focusing on that attention, shall result, some folks were thinking, well, maybe you could maybe do it, but maybe you don't have to. But the interpretation of that language I just read was it's at least 1 day and up to 30 days. What I have recommended, which was a little bit bucking the trend, is since so much effort was made in focusing on already what was a major difference in the penalty, in your case $700 more, I thought in leaning on the fairness, be as fair as possible, that I wouldn't during this fiscal year recommend, and I haven't on any of my corrections orders in other communities, for a fine. I'm sorry, for a suspension. But that's up to each board to decide whether, and I do mention that it's still here. So the law is the law, and I could have scurried and, amended all my mailings and go to my visits and make sure everyone knows it was a suspension too, but I just didn't. I just thought, so anyways.
Yeah.
Sorry to go on so much about that one.
No,
That one kind
Prior,
of tickles
our
me a
old
little bit.
regulations had a suspension after the second sale within 24 months, which was a long time period, which I thought was great.
Yeah.
But it was only like 7 days or something.
Yes.
And it was after the third sale would be up to 30 days. And I think we've only had that once. And that was 15 plus years ago.
Mm.
And the retailer was like, you're going to put me out of business, basically. So I thought that was very unusual that the state put that in there right away. And I was actually shocked. I was like, wow, after one sale, $1,000 and suspension, which I didn't necessarily agree with. I think give them some time to rectify it, pay the fine, and then don't do it again.
Yeah.
But I thought that was very unusual. They added that in there for one sale.
So on, you have young people working with you
Yes.
that go to different establishments to sell cigarettes here in North Andover and throughout the Commonwealth. Is that correct?
That's correct, and we've changed our policy. The state allows us to have 16 to 20-year-old youth, but we have decided to employ only those 18, 19, and 20 at this point. Since this law went up to 21, we just and they're adults too, and I think it's just a better way to operate with adults. Always was. I mean, I say always was. It was a little. They're doing such an important thing, and when you're leaning on still those that have reached at least the point of being an adult to go in there, it was kept you on the edge of the seat a little bit, just in terms of them processing things and such like that.
What if a person in North Andover under 21, computer savvy, buy stuff on Amazon? Can you buy cigarettes on Amazon?
I don't know. I know the internet is I don't believe they do, but I can't tell you for sure. But I do know that your question goes to online sales, and I know this has occurred for vaping, and I know that the Department of Revenue, which has a really big interest in it because it involves taxes or the evasion of such, the local Attorney General state, I should say, Attorney General regulates this area substantially. But we do, there's also, going across state lines and buying things. We hear of that sort of thing. It's one of the things about this job is you have to accept it. You're not going to eliminate. It's to contain. And I have to be satisfied with that. I don't get involved with the internet sales myself.
Thank you. Any other questions for him at all? Once again, Ron, if they have any suggestions, just pass them along to Brian, and as warranted, we'll further discuss amongst ourselves too. So,
Okay. It's great seeing all of you.
thank you again.
Thank you.
Take care.
Yeah.
They
Is it
sell,
time for a motion, or do you have anything else, Brian, you want to go
Yeah,
over?
they sell Stop Smoking Aid transdermal system patches on Amazon, and tobacco and nicotine-free herbal cigarettes. Interesting. Okay. Marlboro tin signs. Thanks, Ron. All good.
Need a motion?
Motion to adjourn.
Second.
All in favor, say aye.
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 Meeting adjourned.